Hello, everyone. My name is Ari Fenn. I'm going to host today's webinar, today's ERC webinar on nursing pathways in education and the workforce. Before we get started, I have a few administrative details. First, this webinar is being recorded. We're going to post that online at our website, udrc.ushi.edu. So you can reference it later or watch it later. Or share it with anyone who you think would be interested that wasn't able to attend. So the format of this, we're going to spend about the first 45 minutes talking about the report, and we will have time for questions at the end. We're going to save about 10 to 15 minutes for questions. So if you do have any questions, put them in the Q&A function so we can easily find those. This webinar will be a conversational format while I will be asking some of my own questions to Dr. McIntyre throughout this session. We will reserve talking about the questions we receive from you all until the end, but please put them in there as they come up. Also, we have the chat function open because we'd like to hear from you so all of our participants can get a feel of who is in the webinar with us. So feel free to please introduce yourself in the chat. You could just simply put your name, job title, and organization. You're also welcome to share anything else about yourself or make any comments within reason. Also, if through the course of this, you have any relevant links to resources or research that is germane to the conversation, please feel free to also drop those in the chat, as I'm sure others attending would be interested in learning about that as well. So if you are new to the Utah Data Research Center, that's UDRC, which I believe I've already said, we're the state longitudinal data system for Utah. And what we do is we connect administrative data on K-12, that's the Utah State Board of Education, post-secondary education, that's the Utah System of Higher Education, employment, the Department of Workforce Services, and health data, the Department of Health and Human Services. And we conduct meaningful research to inform public policy initiatives and help policymakers, practitioners, and the public make data-informed decisions. We provide original research reports and interactive data narratives. Additionally, we also accept data requests from external researchers. We host public events and webinars, such as the one you're currently attending. We also do some in-person events as well. If you want to learn more about us, our website is udrc.ushi.edu, where we have previous reports and data narratives published. So it is now my pleasure to introduce Dr. Alicia McIntyre. She is currently a senior researcher here at the UDRC. Previously, she was an adjunct professor at BYU Political Science, and she has worked for the Utah Tech College system and the South Carolina Legislative Audit Council. She holds a PhD in educational measurement from Brigham Young University, and some of her other UDRC projects include the current program's outcomes analysis and studies of the education and workforce pathways of engineering students. So I'm going to pass this over to Dr. McIntyre now to share more about herself and introduce us to today's topic. Alicia?
Thanks, Ari. Yeah, as you mentioned, my name is Alicia McIntyre. I've been here at UDRC as a senior research scientist for coming on 2 years. And I'm really excited to talk about this Nursing Pathways project, since it includes both elements of CTE as well as workforce, and kind of seeing how these students progress through their early career. Oh, next slide, please. Yeah, so with this project, we had 3 main questions. First, we wanted to know a little bit about who's completing nursing credentials. So this is mostly demographics. And then also, we wanted to know how they progress in their education. Nursing is pretty unique in that it has this very structured pathway between levels of nursing and these buildable credentials. And then we also wanted to know how they're progressing in the workforce, how long they stay nurses, what their wages are, and what the growth is like, in as well as the issues of exit and leaving, because we'll talk about some of those as well. So we also wanted to know about that workforce progress. We have 4 key findings from this research. So first, those levels that are NCLEX certified, so LPN and up, are more likely to gain additional nursing education, and they're also more likely to stay in the field of nursing. Second, successively higher nursing awards have better labor market outcomes, specifically wage outcomes. As they have higher awards, they also have higher wages and different wage growth depending on what credential they have. Third, their industry of first employment will vary based on nursing award level type. So we'll see that at the lower levels, like CNA and LPN, they're working more in residential care. And then as they progress through the levels, they're more likely to work in a hospital setting. And so that might change, the nature of the work they're doing a little bit. And then finally, demographics vary by nursing level. CNAs are on average, the graduating median CNA age is 10 years lower than BSN. And also they're from more diverse backgrounds that kind of match the backgrounds in Utah more generally, whereas that's not necessarily the case for some of the other nursing credentials.
Thanks for sharing those key findings early on so that we can kind of use those as a roadmap to think about your research as you continue presenting it. So while we're on the subject of demographics, let's address that first question. So what are the demographics of our nursing graduates here in Utah?
Yeah, so kind of as a general overview, the vast majority of graduates are coming from our CNA programs. As you can see in this graphic here, 57% of the students in the sample, and the sample is mostly looking at initial nursing degree, or initial nursing award. 57% of the initial awards are at the CNA level. And then it takes quite a drop to LPN. And then we have about 23% of initial award recipients are receiving an associate degree, and then only about 10% of award recipients have their first award as a BSN. And you can see the numbers here. Our sample included a little over 32,000 students who were graduating between the years of 2011 and 2017. And then as far as their backgrounds and some of their demographic characteristics, here we have, you can see each of the different levels and then the breakdown for ethnicity for Utah over here. So CNAs are the ones that most closely reflect the demographics of Utah, or the ethnic backgrounds of Utah. And then whereas LPN, associates, and bachelors are a little bit less reflective of the Utah population. But most students identify as white and female. Hispanic graduates make up the second largest ethnic group at about 13% of the total of the students in the sample. And then if we're looking at age, CNAs are by far the youngest. So the median age for someone receiving a CNA is 19 years old. And then for all of the other nursing levels, they're mostly in their mid to late 20s. So 26 for LPN, 28 for associates, and 29 for bachelors. And again, this is for first credential. So like these bachelor's students are not necessarily someone who's been working in nursing for a long time and going back for a bachelor's, but this is their initial nursing award.
Thanks. So I noticed that, and as you just mentioned, BSNs have a much older age than CNAs. We're talking about a decade difference there. Is 29 older than the average bachelor's degree award earner here in Utah?
Yeah, so yeah, the average bachelor's degree award age is about 25 for Yushi. So this is yeah, quite a bit older than your average bachelor's student. This suggests that, I don't 100% know the reasons for this, but this could be something like either uh, coming to college as like a non-traditional student or switching jobs or switching fields into nursing. But yeah, it is quite a bit. It's 4 years later than the Yushi bachelor average age.
Interesting. Thank you. So let's move on to your second research question. How do nursing students progress in their education? Can you tell us about re-enrollment in higher education?
Yeah. So about 70% of the nursing graduates in this study stayed nurses 5 years out from graduation. About 16% exited nursing, meaning they started as a nurse and then left. There was also a significant chunk of students, 8%, that just they completed the credential, but they never became nurses. This could mean, because we're working with Utah data, this could mean that some of them moved out of state. So we just don't have data for them. So it's a little bit unclear how many of those exit nurses and never nurses stayed in Utah or actually left nursing. And about 49% of bachelor's graduates received a bachelor's in nursing as their additional award, which means that 51% started at another nursing level, CNA, LPN, or associates of nursing, and then went on to a bachelor's. So there's a pretty good rate of re-enrollment into particularly into the bachelor's of nursing. And you can see that here in this graphic. So the initial award is in the middle. We have CNA as the light blue, LPN is yellow, ADN is green, and then the dark blue are initial award of bachelor's. And this kind of shows the flow of where they're going. So if they re-enrolled and had their highest award as like a different award, you can see they start down here. We'll like look at associates, for example. That is the percentage of students, and this is all to scale, of students that started with an associate's and then later received a bachelor's. And then if we look at the bachelor's side on the highest award received, you can see that quite a number of those over on the left received another award first and then had their highest award be a bachelor's. So there's quite a lot of re-enrollment here. And then also we see the ones over on the right. This shows their workforce outcomes. So the percentage that stayed a nurse, there were some that were currently re-enrolled at the time of this study. The amount that exited nursing, the ones who exited all. So the ones that exit nursing in this graphic show the students who show up in the wage data, but in a field not typically associated with nursing. The exit all are the ones that just don't show up in the wage data, period. So they either left the state or left the workforce. And then we also have our never nurses. So they show up in the wage data, but never in an industry that is associated with nursing. And this data, the labor market data, comes from DWS. So we're using NAICS code to understand their industry. But we'll talk about that in detail a little more in a second. So in terms of re-enrollment, the time to re-enrollment is the fastest for LPNs and associates of nursing. The ones who re-enrolled in 1 quarter, within 1 quarter of graduation. And then CNAs, and then the longest time was for BSNs. If they re-enroll, they typically didn't re-enroll for more than a year. And as far as like completing the nursing ladder, and here for CNA, LPN, and associates, we're considering the number that went to BSN. And then for BSNs, we're looking at those who went on to become nurse practitioners. Some of the highest percentages of obtaining a BSN were LPNs and associates. About half of them go on to finish a bachelor's degree in nursing. And then some people, after doing a nursing credential, chose to go on and receive a degree in something else. This was most common for CNAs. 21% of them go on to receive a credential in a non-nursing field, versus single digits for the other types of awards. And most commonly, that different degree was either in a different healthcare profession or in the liberal arts.
No, very interesting on the differences in exit there through education. So you also mentioned that 70% of nursing graduates stay as nurses in the workforce, though. Can you expand on that in regard to your last research question? How do they progress in the workforce? Can you tell us about employment, their first industry, post-graduation wages, and industry exit?
Yeah, so as far as time to employment, we do see some differences in the award levels. BSNs find jobs fastest. As you can see here, this is months to employment. And most BSNs are finding a job in nursing within 1 month of graduation. We also have a number here that are 0. That probably means they have an offer when they graduated or before they graduated. But all of them are finding jobs pretty quickly. So associate and CNA are 2 months, and then LPN is the longest, but it's still only 3 months. So it's still within 1 quarter where most students are finding jobs. As far as their first industry of employment, this also varies depending on award level. So if you look at this graph, you can see that CNAs are mostly finding their first employment in residential care. But then that there kind of starts to be this trade-off between residential care and hospitals as they go up the ladder until you get to BSN, where most of them are starting in hospitals. And if you look at this, the chunk for education also goes up. So since we're using NAICS code here, a hospital attached to, say, a large university like the University of Utah is going to be listed in education. So a lot of those ones here that are first starting in education are actually probably first starting at a University of Utah hospital or healthcare facility. So if that looks a little bit strange, that one's probably also a hospital. Just there's kind of a funky data thing happening here. Um, yeah, so we definitely see some differences there. There are some things that don't change. There are very few nurses who find their first employment in administration, and that's kind of true across the board. Um, Social assistance is also relatively low, but higher at the CNA level than at the other levels.
Would you say that time to employment in this first industry of employment are similar to what we see with other states and or national trends?
I believe so. So there's a huge demand for nurses nationwide. When we talk about like attrition rates, for example, some of the newest data that I've seen estimates turnover for registered nurses at about 18% per year. And so that high turnover also means high demand, and therefore, pretty low times to first employment.
Thank you. Can you please tell us some more about wages of nursing graduates and also about those who exit the profession?
Sure, yeah. So here we have a graph that looks at median wages 1 to 5 years post-graduation. And there seems to be a pretty distinct trade-off, especially at CNA, LPN, and associate levels, in terms of trading off experience for uh, education. Um, so, like if we look at the CNAs, a CNA with about 5 years of experience is making a similar amount to an LPN with 1 year. Um, Similar for an LPN with 5 years of experience versus an ADN. Um, for associate and bachelors, because they're both considered registered nurses, the trade-off starts coming a little bit earlier, at about 2 years or so of experience for an associate degree versus a bachelor's degree. Um, but yeah, they do have also different amounts of wage growth. So 1 year in the workforce seems to really pay off for LPNs. They, in this data, saw a 68% increase in their wages from 1 to 2 years. But all of them see like pretty significant increases with just 1 year of work experience. And then as far as exiting the profession, like I mentioned before, nurses nationwide have a pretty high rate of exit. And this was pretty similar here. So again, for RNs nationwide, I've seen estimates, the latest estimates being between 16 and 18%. And that trend held true here. About 17% of graduates left nursing within 5 years, but that was particularly high at the CNA level. So more than half of CNAs in our sample, um, or sorry, almost half of CNAs in our sample left within 5 years. So only 53% stayed nurses, and about 13% of CNA grads never became nurses, or never worked in a field associated with nurses. Whereas the other ones, LPN, ADN, and BSN, about 90% of them were still nurses 5 years out in the sample. So they had much better retention rates at the higher levels. So some final takeaways. The first award on the nursing pathway seems to really affect whether students stay nurses or not, as well as how much they make. And these differences seem to correlate with institutional guidelines to support additional education. So we have, I saw in the chat that we had some program directors, and yeah, we seem to, at least in Utah, have this like very robust pathway, um, and uh, and that pathway, you know, seems to align with these labor market outcome differences, where additional awards mean better outcomes. BSNs had some of the best labor outcomes, while CNAs had some of the worst. And CNAs also had poor educational outcomes after their initial degree, meaning uh, not as many of them were going into receiving higher levels of nursing compared to the the rates that we see with like LPN and associate degree. Um, uh, this the years that this study covers are from before some schools started requiring BSN students to receive a CNA. So here we kind of get a little bit more of an idea of like someone who is just starting a CNA and just doing that and what their pathway is. And we see that a lot of them choose not to go on to additional nursing awards.
Great. Thank you, Dr. McIntyre. Thank you for sharing your research with us today. Before we move into the Q&A, I want to take some time just to point everyone to where you could find the full report and our interactive data narrative. So the full report is available at udrc.uchi.edu, and you will see it featured on the homepage, and that is currently live. You can also click on publications to see this project in the list of projects or any of our other projects. When you click on the project link, it's going to take you to an interactive data narrative where you can go through. This is the screenshot on the right. So we have several interactive charts and graphs where you can really dig a little bit deeper into some of those numbers that Alicia just presented. And we can also see different components of that data. I want to take this time to thank Wei Li, who is our senior data scientist at Data Narratives, who built this data narrative for us. I'm now going to go ahead and open it up to Q&A. If you have any questions, please drop them into the Q&A tab. Since I don't see any in there yet, I have a couple prepared while everyone else kind of thinks through some. So Alicia, one of your findings was that 17% of all graduates left nursing within 5 years. Why is it that nurses are leaving the profession? Do we have any sort of intuition as to what's going on there?
Yeah, so I did see a report recently that talked about how nurses have some of the highest rates of workplace injuries compared to other professions. And like in general, especially at some of those lower levels like CNA, it can be a pretty physically taxing job. And so that might be part of the reason for burnout. Uh, Also, other things like staffing issues. Hospitals are required to have a certain number of nurses at different levels there at all times. And so when you couple, you know, with some people leave and then they might take a while to replace, you might end up with some staffing shortages that could put an additional burden on the people that are left. So I think there are kind of a few factors that are working to push that number up. But it was a pretty similar rate of leaving to what we see nationally.
Great, thank you. I don't believe we have any questions in the Q&A yet. Let me double check. In that case, I'm just gonna keep asking you questions. So let's pretend I'm a student who's interested in going into nursing. And I come to you and ask, what would be, what award would you suggest I start with? Should I start with the CNA? Should I try to go straight into a BSN? Kind of based on labor market and other education outcomes, how would you kind of explain to me what my best or what the optimal path might be.
Yeah, the optimal path, I mean, well, it depends on what you're trying to solve for there, right? BSNs do have some of the best outcomes that we've seen. But there is an argument to be made for starting at the associate level. So they also have pretty good wage outcomes. They find jobs relatively quickly. And I know at least at one point, I don't know if this is the case, someone can talk about this in the chat if they want, but I know that at least at one point, Intermountain and some other large healthcare systems were actually sponsoring students who, had an RN, an associate's degree level RN, to go back to school and do an associate's to bachelor's pathway. And I know some of our USHE institutions offer that. So that could be a way to get into nursing and have pretty good outcomes, but also, get sponsored and have your bachelor's paid for. So I think that's also a really great option. I don't know that I would suggest that someone start at the CNA level, since it seems like that seems to be a tough starting point, and we don't see as many people starting with a CNA and kind of going through the full path. So, depending on what a student is going for, I would maybe suggest an associate's or bachelor's.
Great. Thank you, Alicia. So we've actually got two questions now in the chat. So first, how might this data affect nursing programs? What should nursing programs be thinking about with this data in mind?
Well, I think one of the things that this report highlights are the strengths of some of our existing programs, particularly like our existing bridge programs. It seems like they're, especially at the LPN and associate level, like our schools have done a pretty good job of creating programs that help them move along the nursing pathway to higher credentials. But there is the place where there maybe could be, where there is maybe a little bit of a rub, is the CNA to additional, well, to any of the higher levels. That seems like, an area that that could be improved a little bit. So yeah, but it seems like there are really strong pathways for LPNs and associates to get a BSN, which is, pretty great. Great for our students and um, uh, and and good news for the labor market as well.
Thank you. So we're going to go back to the third slide really quickly. We've had a question. How many people were in this study? Let's see. So we're going to go with this third slide.
Yeah.
Yeah. So how many? Can you briefly, I guess, talk about who's in this study a little bit more in depth?
Yeah. So these are all graduates with initial awards from 2011 to 2017. So there are a lot of CNAs over that time. And then here we can see about a little over 3,000 LPNs, 7,000 associate students, and about, again, a little over 3,000 bachelor's students over these years. And these include USHE students. So, we're not including like students from BYU or Western Governors, but yeah, these would just be public students and their first nursing credential. So like if someone got a CNA and then eventually went to an LPN, they would be counted in the CNA category, but we're still capturing if they received additional education within those 5 years.
Thanks for expanding on that, Alicia. So we have another question, comment. So from this data, would you think requiring an individual to take a CNA class as a prerequisite for nursing school might not be a good idea?
Yeah, I guess it depends on, I'm just thinking through this. I think CNAs have a huge rate of leaving because it's like the most physically demanding of all of the nursing levels. Um, I mean, it maybe could, I don't know, I'm kind of two minds of it because it could be helpful. It could help them see like, uh, maybe some of the tougher realities of nursing. But that might also scare them off before they have a chance to understand like what their scope of practice would be. Like, for example, if they're doing a bachelor's and they're required to do a CNA first, those are pretty different scopes of practice. And so it could also maybe give them the wrong impression of, the scope of practice they would be going into as a bachelor's graduate. But at the same time, uh, you might also want to start someone getting used to patients and getting used to working with the public. And maybe you don't want to put that experience off for too long. So I think there are pros and cons to it. I don't know if requiring it, maybe you don't want to require it, but encourage it. But I know now it is pretty common for bachelors to require getting a CNA. So again, they're kind of pros and cons. You might have a little bit of an increased dropout because of that, but you do also want them having experience with patients as early as possible because that can be really valuable. So it's I don't know. I think some of the directors here would probably have a better idea of how that goes. But just thinking through it, I think there's some positives but there might be some drawbacks as well.
Thanks. So this is a very interesting question. So do we have any idea about the retention rate of nurses in urban and rural Utah? Are there any barriers to retention of health workers, particularly nurses in rural Utah?
Yeah, so in this study, we did not include urban versus rural. My sense is probably that rural might have a higher retention rate. So I'm going to look that up right now. Because I know at least I know that this is true for physicians, that it's more difficult to recruit physicians into rural hospitals. So yeah, looking at a study that I found on PubMed just now, they estimate that turnover is about 19%. And this was in rural areas in South Dakota, North Dakota, and Minnesota in about the same time frame. So yeah, that does suggest that the turnover rate in rural areas might be a little bit higher. As far as Utah specifically, I don't know, but I wouldn't be surprised since that does seem to be generally an issue in healthcare is retention in rural areas.
So I'll quickly, this one wasn't explicitly in the chat, but I'll just ask, can you explain why you did not include that in the research?
Yeah, I am not sure that we had like the DWS data can be a little bit limited, particularly when talking about large hospital systems, because like the employer might be listed as like the headquarters for Intermountain, even though they might actually be working at a facility in a rural area. And so we're just a little bit limited on tracking exactly who was working rural and who was working urban.
Thank you. So next question, why do you think there's more difficulty encouraging CNAs to attain additional credentials? This is kind of related to when you were discussing the bridge programs.
Yeah, so anecdotally, my mom was a CNA, uh, and like it's just a really hard job. It's a really physically demanding job. There, might be a lot of staffing issues depending on where you're working and where you're employed. And so I think, if someone is having a tough time with their job, it just might be difficult to encourage them to keep going at all in nursing. Um, uh, and so that's, again, this is anecdotal, but um, and then also, we didn't talk a whole lot about this, but the certification for CNAs is a little bit different than the certification for the other levels. So CNAs are licensed um, through a state license in Utah, whereas the other levels are taking the NCLEX and they're receiving national certification. Um, and so I think those differences in the way they're certified might also it just might be a little bit easier to build when they're kind of building through a national certification track versus kind of hopping over from state to national. But yeah, it is, I think there is the issue of it just being a really tough job. I think that also contributes to why a number of CNAs graduate with their CNA, and then by the time they graduate, they just don't even want to be a nurse. They exit nursing at a pretty high rate. And so it's probably kind of a tough sell if someone is currently having a tough time in their job to say, yeah, please do more of it. But that's just kind of my anecdotal sense. But there is a little bit of evidence since we see a much higher rate of exit. And also they're a lot younger. Um, as we saw, they're 10 years younger than your average BSN grad. So there might just be an element of like experimentation in their career because they're just at the beginning. And so they might realize kind of early that they would rather not continue in nursing and would like to switch to something else.
So related to, you just mentioned, the age is much different than that of BSNs. From another question, have you considered that many high school students go through CNA training but never go further? And what we might be seeing kind of an artifact of that rather than an actual difference.
Yeah, there might be some of that in here. I believe this study only included adult students, but if they're 18 or they receive their CNA, like they finish their CNA just barely after high school graduation, they could still end up here. But yeah, I think that is the age is probably definitely a factor in the high rate of leaving nursing as well as the high rate of never nurse among CNAs. This is also a pretty short credential. Um, uh, so it's relatively accessible, but that also means that you might have a lot of people who kind of do this shorter credential and then realize it's not for them. But yeah, to my knowledge, this study only included adult students, not like concurrently enrolled high school students.
Thank you, Alicia. I believe that's all the questions we've had. Those are some wonderful questions. Thank you, everyone, for participating. Since we still have you for a few more minutes, oh, we have one more share. So CNA certification requires a short amount of time to obtain and costs far less than nursing school. Is there any data gathered on reasons CNAs are not able to go on in school?
Mm. Yeah, we did not look at that specifically here since, this is um, enrollment data and like W-2 data. So we didn't like do a survey to ask them why they don't continue. But I know from a presentation that I went to a while ago, like at Weber State, they talked a lot about that, about how particularly if students have already completed like 1 or 2 years and they drop out, that usually financial aid is a factor there. So I wouldn't be surprised because yeah, there is kind of a jump in price, like or cost of going to school. CNA is relatively short. LPN takes about a year, and so that time difference might also, or if they want to do an associate's, um, yeah, there could also be some like financial aid or uh, economic considerations there as well. It's also probably a bit more difficult to pay for school while working as a CNA, since as we see on the wage slide, a few slides up, um, there we are. Yeah, like the first year income for a CNA is pretty low. We're looking at just barely over minimum wages for their first year. So even if they're like trying to work themselves through school, it would be pretty tough at that kind of annual income.
So related to our CNAs, with the data on CNA degree progression, are there any employers creating a pathway from CNA progression to LPN, ADN, or BSN that we are aware of?
I'm not aware of any. I know that there are some of our institutions are kind of going the other direction. So, for example, at in BSN programs or ADN programs requiring a CNA, but I don't know. I haven't heard of any like specifically CNA related bridge programs. I've seen a lot of other ones, LPN to BSN, ADN to BSN. Um, uh, but yeah, I haven't heard as many bridge programs specifically for CNA. Um, but I don't know. Maybe someone from, I saw that there were some tech colleges. I could see maybe a tech college doing a CNA to LPN, but I'm not totally sure. Um, oh, it looks like uh, we have a comment that says South Davis Community Hospital might be sponsoring CNAs to do an LPN or RN. So yeah, it looks like there might be some tuition reimbursement options and that kind of thing. Um, but as far as the institutions, I've seen more LPN to BSN or ADN to BSN there.
So here's a question that, as a trained economist, is near and dear to my heart. Do you think wage increases for CNAs would be an effective solution for the CNA gap?
Yeah, I mean, uh, again, anecdotally, I think they would, especially since like uh, the wages that we're seeing for uh, first or even 1 to 5 year CNAs um, are pretty low. So like even with 5 years of experience, the median wage for CNAs in this study was uh, just over $10 an hour or the equivalent of $10 an hour. Um, and like I said, it's a pretty hard job. They have higher rates of injury, um, and it's tough. I'm sure it's a tough sell to convince someone to stay being a CNA when the starting wage at Target is like $18 an hour. They could almost double their wages by leaving. And so I'm sure that is a factor in the high turnover rate for CNAs.
So there's some more discussion on pathways. I'm going to forego those for just a second to focus on a specific question. So how do nursing wages in Utah compare with the rest of the country?
Yeah, that's a really great question. So DWS has this great tool where you can look up, and I don't know why this is not working all of a sudden, um, uh, based on their W-2 data that allows you to look up um, some of the wages for different jobs in Utah. Um, and let's see. So I'm going to use that to look up some of this nursing data real quick.
So while Alicia looks those up, I'll just make sure everyone's aware of the pathways discussion. So at Davis Tech, there is no official bridge from CNA to LPN. The only bridge from PN to Weber State's RN program. So apparently there's a lot more knowledge needed between CNA to LPN. And then Proxima is a pathway program for students interested in nursing. They become CNAs first and follow a timeline to become nurses. It's in its initial phase, though. If you want to drop a link to that Proxima, I think people might be interested in that. Thank you for sharing it. And so I'm going to give Alicia just another second. And this is something that is available, I believe, for everyone on the Department of Workforce Services website to compare wages and look at the economic outlook of different professions.
Yeah, I think that service might be down. So everything I try is giving me an error. But they do have no.
Thank you for that link,
Yeah, sorry.
Proxima.
Yeah, sorry. I'm trying all kinds of things on DWS's website that are not working. Uh, yeah, so
I guess, unfortunately, interest of time, we'll have to leave that one unanswered currently. That is a
yeah,
great question.
yeah, sorry about that. I can't seem to find that. But yeah,
So
I'm gonna look that up later because I'm also interested. But yeah. Oh, Carrie dropped a link.
So I guess we could leave others to explore that on their own. We have 5 minutes left. I believe the rest of the questions have ended. I'm going to take this time just to give you a minute or two to shamelessly plug your upcoming research for a minute or two.
Oh, sure. Yeah, so I'm currently working on a similar study for engineers. And this is everything from engineering and engineering tech related certificates all the way through graduate degrees. And yeah, the difference between that one and this one is that this engineering study will include a college readiness component. So looking at those who received an engineering credential and then tracing back to some of their high school and even middle school related indicators to see what their preparation was like for them, as well as some of these workforce outcomes and re-enrollment outcomes that we covered in this nursing related one. But yeah, so far, that one's pretty interesting because it suggests that there might be some saturation in the engineering market in Utah. We see a pretty high rate of leaving the Utah labor market. But yeah, I look forward to the next time I get to present on that one.
Great. Thank you, Alicia, for presenting your research. Thank you, everyone, for participating and for the discussion. I'm glad you were all able to attend. And for those of you who will be at our next one, we look forward to seeing you there. And this, just a reminder, is available udrc.ushi.edu. Thank you all.